Many diseases are transmitted through contaminated food and water. Only drink water from safe sources, which include water in a sealed bottle, boiled water, or water treated with iodine or bleach tablets. Filtration systems can be used, but are not as effective. Be careful if you get ice in your drink, as it may be made from unsafe water. Do not use tap water to brush your teeth. Other safe liquids are carbonated beverages and hot drinks such as coffee or tea. Avoid unsafe foods. Remember, heat kills most microorganisms that can make you sick, so foods that are cooked and served hot are generally safe. If you can see steam coming off the food, you know it has been kept at a good temperature. Breads and dry products are also safe. Fruits and vegetables are fine as long as they have been washed with clean water and peeled. Avoid unwashed and pre-cut raw fruits and vegetables, raw or undercooked meats and fish, any cold sauces, condiments, or food that has been left out at room temperature for an unknown period of time. There are vaccines that can be very effective in preventing specific foodborne illnesses. Hepatitis A vaccine is a 2-dose series spaced 6 months apart. Typhoid vaccine comes as an injection or a series of 4 pills. Cholera vaccine is rarely needed and is only available by special order. Please be aware, vaccines take time to become fully effective, so plan accordingly. Diarrhea is the most common illness among travelers. Hand washing, eating safe food, and drinking safe water will help prevent not only diarrhea, but many other illnesses as well. For mild to moderate diarrhea with no fever, you can take over-the-counter medications such as Pepto-Bismol or Imodium. It's important to always read the instructions before taking any medication. If you have severe diarrhea and a high fever or blood in your stool, you should not take these over-the-counter medications. Instead, you should take an antibiotic. Your travel nurse can provide you with a prescription. Travelers may also experience constipation, which could be caused by a change in diet or dehydration. Be sure to stay hydrated. Dried and fresh fruits, juice, coffee, water, and caffeinated sodas can help prevent and relieve constipation. Insect-borne diseases include malaria, yellow fever, dengue fever, chikungunya, Zika, Japanese encephalitis, leishmaniasis, tryptomyosis, and West Nile virus. To prevent insect bites, avoid scented soaps, lotions, and perfumes, and wear light-colored clothes as mosquitoes are attracted to dark colors. Use insect repellent that contains either 20 to 35% DEET or picaridin 20%. Apply after sunscreen as you want the DEET on top to keep the mosquitoes off. You can also spray your clothes with permethrin. Military studies show that using DEET on the skin and permethrin on clothing reduces mosquitoes and tick bites by 98%. Preventative medication is available by prescription for travelers going to high-risk malaria areas. Some countries require proof that you have received yellow fever vaccine. Only 1 dose is necessary, but some countries do require boosters. The 2-dose Japanese encephalitis vaccine is available by special order. If you are pregnant or planning on becoming pregnant, talk to your doctor before traveling out of the country, especially if you are going to a Zika area. Other travel-related diseases include schistosomiasis, leptospirosis, and a variety of worms. It is best to avoid walking barefoot, swimming, or wading in fresh water. If you will be participating in these types of activities, an antibiotic can be taken to help prevent leptospirosis. Tuberculosis is common in third world countries. Avoid people who are coughing or who appear sick. Rabies is transmitted by mammals, particularly bats, dogs, mongoose, monkeys, and cats. If you get bit or scratched by an animal, wash the area with soap and water for 15 minutes, then seek medical attention. Rabies is 100% fatal if not treated in time. Many travel-related diseases have similar symptoms such as fever, chills, and muscle and joint pain. If you experience any of these symptoms during or up to 6 months after you get back, seek medical attention and let your doctor know. Traveling to altitudes higher than 8,000 feet can cause problems and potentially become life-threatening. Medication can be taken to help prevent altitude sickness. Staying hydrated, avoiding alcohol, and spending time at higher altitudes before you go can help prevent illness. If you are traveling with children, be sure they wash their hands frequently or use hand sanitizer. Educate children about avoiding animals and be sure to apply insect repellent and sunscreen. Accidents account for 25% of all traveler fatalities. Vehicle accidents are the most common cause of injury and death. Many of these are vehicle-pedestrian accidents. Remember, use seatbelts when available. Have maps and know where you are going. Walk cautiously in areas where you are at risk for being hit by a car. Avoid high-risk activities such as tattoos, acupuncture, piercings, and medical procedures, as many destinations have a high rate of blood-borne and infectious diseases like hepatitis B, HIV, and antibiotic-resistant infections. Travel vaccines and medication are very effective in preventing disease. Please contact our clinic for pricing, as most insurances do not cover the cost. Keep medications in the original bottles packed in your carry-on bag. Some countries have restrictions on both prescription and over-the-counter medications. Be prepared by bringing a first aid kit and basic over-the-counter medications that are permitted by the country. Travel insurance with medical evacuation is highly recommended and may be required for your travel destination. Take 2 copies of the first page of your passport. Leave 1 copy with someone at home and carry the other copy with you in case your passport is lost or stolen. You may also need your official vaccination record. Original birth certificates may be required for children. Avoid theft by bringing cash in smaller denominations. Tell your credit card company when and where you will be traveling. Also, check with your cell phone provider regarding international phone use. Don't attract attention to yourself by wearing expensive jewelry or clothing. Don't take anything with you that you aren't okay with potentially losing. Research the country you're visiting to understand their culture. Note that some behaviors are not acceptable, such as using the index finger to point at someone or showing the soles of your feet while sitting. Dress modestly. Respect others' religious beliefs and observances. Ask before taking photos of people, government or religious buildings, as doing so may result in fines or detention. Time to schedule your travel consultation.